Quiero presentarles a ustedes al doctor Michael Schmidt. Él ha estado liderando también por largo tiempo, por largos años, lo que es la intervención en unidades de cuidado intensivo en Estados Unidos, específicamente en el Hospital Clínico de South Carolina, donde él es jefe de epidemiología y microbiología de esta universidad. Él ha sido activo participante en lo que significó la certificación de distintas aleaciones de cobre y el cobre como un material que protege la salud de las personas al eliminar patógenos al interior de la Environmental Protection Agency en Estados Unidos. El Dr. Schmidt desde esa fecha ha mantenido sistemáticamente la implementación de cobre en la unidad de cuidado intensivo con resultados que vamos a mostrar ahora. Dr. Schmidt, welcome. Thanks for being with us. All yours.
Thank you, Victor. Buenos días. I apologize for not being able to speak in Spanish, but I am so delighted to be with you this morning to share with you the value proposition that antimicrobial copper affords healthcare and for the improvement of outcomes. So let's go to the first slide. And since my time is short, I'm going to hit you with the conclusions first. Antimicrobial copper surfaces simply work. The evidence is overwhelming. The reason copper works is it consistently and continuously, that is the most important word, continuously kills bacteria, fungi, and now we know it can inactivate viruses. This then results in the reduced risk of transmission of infectious agents to our patients, healthcare workers, and visitors within our hospitals. It improves patient outcomes by lower infections, reduce complications. It reduces costs of care. In the United States, it avoids financial penalties. And in today's world, it will help businesses recover after the pandemic of COVID-19. Now, you need to appreciate that copper is the only touch surface material in the marketplace today with an inherent ability to kill pathogens responsible for infections. This has been proven on countless occasions in that copper efficiently kills bacteria and activates viruses responsible for these healthcare associated infections. And in fact, in studies that I have conducted, we have found that it significantly reduces the rate of hospital or healthcare associated acquisitions. In today's world, we need to ask the question, well, what about COVID? And in a recent New England Journal study, it has been demonstrated equivocally that SARS-CoV-2, the virus responsible for COVID-19, was inactivated quickly on copper surfaces. This is a remarkable observation that copper, in not only hospital settings, but in other areas of our communities, whether it be transportation, whether it be in restaurants, can actually greatly control the spread of this virus. Now, we have a lot of data out there, and these are just some of the screenshots of the front pages of papers that we have been involved with the exception of the New England Journal paper in 2020, that demonstrate that the value proposition that copper offers. Now, let's think about the significance of the challenge of controlling healthcare associated infections. If I were to ask each and every one of you on this webinar, if you would get on a plane, if one would crash every day for the foreseeable future, and that is indeed the statistic that we witness in the United States from the deaths resulting from healthcare infections, you would never get on a plane. Yet, as you can see in the graph to the lower right, infection rates are high across our globe, with a high in Canada at 11.6 and a low in Korea at 3.7. So the global rates of healthcare associated infections are significant. If we fast forward to the pandemic that we are facing, we all understand the scary statistics of what's been going on in the US with COVID cases and the frightening trend that we are seeing in the Republic of Chile. The number of cases are increasing with each passing day, much to the chagrin of healthcare professionals who are trying to control this outbreak. Now, the significance of our challenge really lies in the fact that we're not good at following the rules. Hand washing compliance is less than 50%. And when we look in the built environment, we find that our cleaners are only doing about 48% of the jobs they need to do in order to make certain that those surfaces are indeed risk-free for our patients. But when we look specifically at objects that are in close proximity, and we heard in the previous presentation about the wonders that went on at the Hospital de Cobre and, of course, at Hospital Roberto del Rio, which both studies I was involved with, we see that the bed represents a substantial risk. The risk is omnipresent, always there in our built environment, and copper can offer us an opportunity to greatly mitigate that risk. The conclusion from this brief introduction is that the burden in the built environment, whether it be in hospitals or whether it be in restaurants, transportation centers, represents a clear and present danger to all admitted for care in spite of our best efforts. Now we move to the opportunity that antimicrobial copper surfaces can afford to solving or addressing many of these problems. Copper has been used by the human race for over 8,000 years in everything from tools to jewelry to our coins. How copper works is really pretty remarkable. It literally goes after the ability of the microbe to generate energy, and it effectively knocks it down. It collapses the membrane potential, which then leads to the destruction of the nucleic acid as a result of the free radicals that are generated secondary to contact with copper surfaces or copper materials. So here's the central theme of what we need copper to do, and this is precisely what copper does. It results in cleaner environments. In many of the studies, it's over 90%. This then results in a lower risk of infection. We have demonstrated that it results in greater than 50% reduction in that infection rate in hospitals. This then leads to better outcomes and, of course, lower cost. Now, the clinical opportunity that copper can afford healthcare is the next section I'd like to introduce you to. We know that microbial burden matters, and here it is writ large with the infection rate. And as you see, as burden increases, so do the number of infections. And in fact, we didn't have very much copper in the built environment. What you saw in the previous presentation is one example of a hospital in Chile. And here we see another hospital in the US. There is not much copper in the room, yet the benefits of antimicrobial copper are indeed significant to reducing the risk of infections. And in fact, here it is in the raw data. You see that the level of bacteria on the arms of the patient rail are quite significant. And when we look contrasting over to the copper rail, and you can see there's not much copper on this bed, it effectively reduced it substantially. When we look at a number of other objects in the built environment, again, using the stoplight metaphor of red means risk, green and amber means safe, you can see that copper alloy surfaces greatly reduce the risk of transferring microbes to patients or visitors or healthcare workers simply from interacting with those surfaces. So copper can minimize our risk. This is especially important in the pandemic situation that we are facing ourselves in here today. Now, the industry has stepped up. They have begun to fabricate copper from traditional materials, and you can see that a large number of copper materials are in place. What our challenge is to convince architects and designers to specify copper when they're designing or remodeling various locations in our healthcare environment and other public spaces. This is a paper that I just published this past January, and what you see in the graph to the right is that a patient stays in the bed, even though these beds are cleaned once each day by diligent environmental services cleaners. You can see that the burden increases as a function of time. Yet when you look at the rate of the burden in a copper bed, you can see it's well below that risk threshold of 250 colony forming units per 100 centimeters squared. So that again demonstrates that copper offers a significant advantage to controlling risk in our built healthcare environment. So this was an infographic that was published in the Wall Street Journal a couple of years ago, and we were able to demonstrate that, yes, indeed, copper did improve cleanliness. But the question that everyone always asks, but what about infections? And the answer is an affirmative. Copper surfaces significantly reduced healthcare associated infections. And in this particular study that I'm quoting, we were able to prevent 16 infections in the 3 beds that we had copper surfaces on, which resulted in a conservative savings of about $750,000 US, and the important bit, over 301 days of hospitalizations. The rate of infection reduction was 58%. This is quite dramatic in its findings, and it really argues for the incorporation of copper into the built environment. So the conclusion so far is that the research supports that copper surfaces can complement cleaning by reducing bacterial burden within the built environment, facilitate the terminal cleaning standards that our regulatory agencies require of us, not only once, but on a continuous basis. Let me stress that again, on a continuous basis. And this indeed will result in improving patient outcomes. So the overall conclusion so far is copper can continuously complement cleaning, controlling microbial burden within the built environment, resulting in hopefully improved patient outcomes wherever we happen to place copper surfaces. But the question that is on every businessman's mind, whether they be in charge of running a hospital, whether it be the Ministry of Health, is will it save us money? Will it save us dollars, pesos, euros, pounds? Everyone wants to know, and it's a balancing act between the cost of hospital-acquired infections and the cost of the intervention with antimicrobial copper touch surfaces. Shall share with you some of the data that come from our healthcare statistics in the United States. We know that the average length of stay of an individual in a U.S. hospital is about 5 days. Should they acquire an infection due to their care, that increases their length of stay 19 days. It's no surprise that an infection can actually increase their risk of dying. And in fact, it's a 6-fold increase in whether or not they will succumb to the infection they have acquired in the hospital. And more importantly, whether or not that patient has to be readmitted to care within 30 days. In the United States, this results in a substantial financial penalty, and you can see that the cost of care by acquiring an infection goes up by about $43,000 US, and the readmission rate is approximately 2.5 times greater should they acquire a healthcare acquired infection. Finally, I want to plead with you. I'm sort of an evangelist pleading on behalf of industry to really encourage healthcare industry to leverage the antimicrobial benefits of copper. This is no more important now that we're in the midst of a pandemic. I think that the copper industry can help promote the potential of public health benefits of copper. It can help institutions understand the benefit that they will receive by outfitting or retrofitting their establishments with copper products, whether they be beds, IV poles, overbed tray tables, handrails in the hallways. They just need to consider the incorporation of copper into their built environments. So I would encourage industry, government agencies to consider limited investment so hospitals and healthcare institutions can really appreciate the value proposition that antimicrobial copper surfaces can offer. There also needs to be a renewed effort in the commercial development of products and applications where copper has been demonstrated to have utility. Many of you have been probably seeing the advent of copper masks for the controlling of COVID. That certainly is a good application where copper has a demonstrated potential benefit, and those data were published well over 10 years ago, specifically for influenza. So clinical trials are an important investment opportunity where the principal outcome is really the return on investment, the better patient outcomes that results from the incorporations of antimicrobial copper surfaces. And finally, consider opportunities beyond healthcare, whether it be in transit situations, whether it be in education, whether or not we have copper surface desks, whether it be in the lodging and travel industries, whether it be in retail or in fitness facilities. And in fact, there are publications out there demonstrating the utility of copper weightlifting equipment in fitness facilities for reducing the incident contamination on shared equipment in those fitness facilities. So my plea is to reassure customers that businesses can utilize all technologies available to them to ensure their safety, especially during this global pandemic. Finally, I'd like to share with you the sentiment that is on the back of the United States 1-cent coin. It's a Latin phrase, e pluribus unum. And anytime any of you handle copper coins, I want you to think, out of the many infections that we have out there, there is but one solution, and that is antimicrobial copper can actually augment our ability to reduce healthcare associated infections. So they go hand in hand with each other. So I'd like to thank you for your time this morning, and I would be happy to answer any of your questions.